Hi everyone, this is Dr Raquel Butler from Integrated Veterinary Therapeutics.
And Sophie Vandenberg from Equine Posture. And we welcome you to the Equine Functional Posture Podcast, your ultimate source for insights into the influence of functional posture on biomechanics, health, and overall well-being of horses.
Whether you're a seasoned equestrian, an equine professional, or simply a horse enthusiast, this podcast is designed to help you understand the critical aspects of functional posture.
Tune in each week as we discuss practical tips, delve into expert interviews, and explore the latest research in the impact of functional posture on equine anatomy, physiology, movement, and more.
Let's create a world where we empower our horses to be in a mental, emotional, and physical balance. Hi everyone, welcome to this episode where we're discussing appreciating all the muscles and the kind of complexities of the body rather than narrowing it down to one particular muscle. So how are you going today, Sophie?
Hi, Raquel. I'm going really well. This one's been on the list for a little while, so I'm glad we've got around to putting it out.
Yeah, it is interesting because there are a lot of talk about different muscles, such as like the thoracic sling or a little bit about the core or the brachiocephalicus or the psoas muscle group. And so we can easily get caught up in just thinking like only about one area, like only about the thoracic sling or only about the brachiocephalicus or only about the glutes or something like that. And we forget that it's all connected and that you can't have like an area in the body that's over or underworking or over or underdeveloped and not have a whole body thing going on there.
Yeah, compensatory system. You might have a part of the body that's doing well, but certainly making up for an area that has a stronger dysfunction. There's always going to be a level of compensation going on.
Yeah, it definitely. And we see that, like whenever I'm looking at a horse's body, I'm always kind of assessing like the obvious muscles. Like obviously if I see a brachiocephalicus that's really overdeveloped, then I can see that there's a postural problem going on here. But because a brachiocephalicus is overdeveloped or overworking, it doesn't always mean the same thing for the horse. Like sometimes it means that it's the way it's being ridden. Sometimes it means that it's like they've actually really restricted in their vertebrae and they kind of can't get flexion through their vertebrae and lift. Sometimes it means that their hind end is sore and that they don't want to load up their hind end. Sometimes it means that there's a saddle fit issue, that's creating a problem. And so if we just get stuck on focusing on fixing that, then we forget that there's like a whole lot of other things that could have led to that we need to address. Yeah, so when you kind of think about appreciating all the muscles, what does that mean to you?
Really understanding that, like you said, the whole body is so connected, and so it can be easy and sometimes necessary for people to explain things, if you're a body worker or a trainer, to people in a way that doesn't overwhelm them. But understanding that when you are evaluating a horse's movement, every single muscle in the body is contributing to the quality of that movement. So the way the head and neck projects from the front limb is a representation of all of the muscles, from the scalenes to the longus colli, the splenius, the spinalis, and on all the other muscles they talk about through the shoulder and the brachiocephalic. There's just so many muscles and fascial planes, nerves, like there's so many things that contribute to that. That sometimes when you look at a muscle, say we're talking about the brachiocephalicus, it can be a representative of all those issues, and sometimes it's not, or sometimes it can be described as overdeveloped, but another area is actually underdeveloped.
Yeah, and it's the other area that you maybe have to
Yeah. And it's impossible for every horse person to become an expert on anatomy and what it should and shouldn't look like. But thankfully, there's great practitioners around. There's a lot of good body workers and good trainers who've taken the time to invest in their time and money and effort acquiring that knowledge. And so it's wonderful that there are people around to give insight or to help people make those evaluations too.
Yeah. And I was thinking then when you talk about, how everything is connected, I dissected a foal last week that he'd had to be put down due to a fractured leg. And it was my first full foal dissection. And it was so interesting because we really do look at things in quite a reductionist view of the muscles, And what struck me was how connected everything was. And it was so difficult to actually separate the muscles. Like, I was having a hard time finding the lines between the individual muscles and going, oh, yep, like that's trapezius or that one's probably not a great example, but like where does the separation between serratus and external oblique, like they're really connected, serratus ventralis thoracis and external oblique. So they're one muscle is thoracic sling, one's an abdominal muscle, and they're so connected. And as we're dissecting them, like the lines, yes, we could see the difference in fiber alignment and arrangement, but where one blended into the other, it was seamless.
Yeah.
And even the development of the fascia, like the fascia and the muscles were really continuous, whereas in an adult horse, like it's much more obvious the demarcations between fascia and between different muscles. And as a horse develops, the fiber types within those muscles change. And so you get muscles that are more stabilizing muscles that are more power muscles. And so they get different muscle fiber types. And so you can see that like difference in color of the muscles, for example, with an older horse, whereas the color of this foal's, and it was about a month old, the color of this foal's muscles were so uniform. And so it hadn't had the exercise yet. So yes, they'll have a predisposition towards a fiber type depending on breed and that sort of thing, but it hadn't had enough time to exercise to develop the muscles in certain ways. And so yeah, and also just how the muscles continued into the bones, like how the bones were so soft, how easy it was to slice through the bone. But there was such a continuation through the entire body of all of those connections. So muscles to bones to fascia, to cartilage. And so, the adult horse is a product of how the body has been utilized, but it's still all so connected. And I would do something to the front foot and we could easily see it in the back foot. We did the tongue hyoid connection thing with the back leg. It's the first time that I felt that movement in the tongue. Like my pressure on the tongue was so light, but they were moving the back leg and I felt the tongue moving. And so that's not, yes, we talk about that specific connection, omohyoid to cutaneous trunci to the stifle, but that was not that connection. It was a whole body flow of motion. And that's exactly what we're talking about here, is that you can't isolate a muscle or group of muscles and say we have to do the exercises to develop, activate, switch off that muscle, because what we talk about through all of our podcasts is that we need to appreciate the body as a whole and that every muscle has a function. Every muscle should be able to work, but it's like developing the best efficiency in that work.
Definitely. And I think understanding that correct training, so postural work alongside the kind of training that encourages the horse to engage but doesn't restrict them, allows the horse to develop the whole space, and that comes after making sure that your horse has function, which we've also talked about, the idea that sometimes there are limiting factors in the body. For example, an injury that might have reduced the horse's use of that muscle, and you want to get it functioning again well, and then you can ask them to use it appropriately. And once you have that, you can build up the whole body together. But correct styles of training are important because they encourage the horse to use their body as a whole. You're not only focusing on one area or just one space. And even if you are working on a specific movement, you're trying not to do it at the expense of other parts in the body, teaching disengagement and overworking your hips, things like that. It's important to consider the whole body and every part of it.
Yeah, definitely. And like I have a few horses that I treat, like you talked about, working within their kind of function. And I have a few horses that I treat that have had quite severe traumatic injuries, like one's had a fractured pelvis, one's had a fractured wither, other horses with like deep scars that they've had since they were foals. I have another horse with its spine literally is like a snake. And, our aim for these horses is functional dysfunction. Like, I'm not going to change the fact that they had a fractured wither or a fractured pelvis or that their spine is crooked. But what we can influence is the function within that dysfunction and the comfort within that function. And that, again, is a whole body aspect. So we could say, oh, well, this horse has had this, so it can't do this. And it's like, well, I was listening to a podcast actually last night. It was on the telepathy tapes, which is awesome. But they were saying it was about autism. So I'm just getting off track for a second. But what they said was we have to ask the question of what is possible. And so when we're asking a horse to move and thinking about its like using its body rather than getting like really focused on, oh, we have to get this muscle to let go or this muscle to activate or this muscle to do this, which, I certainly do those things. But it's asking, okay, well, what movement is possible within the function of this body right now? And, how can I optimize that in a state of relaxation and comfort without getting like pinpoint focused into one area and one muscle. Like if I'm asking the hind limb to engage, or say yesterday I was working with a horse with like leg yield, getting caught just in that how that hind limb moves is not helping the horse. I have to have an awareness of like how the shoulder is moving, like what's the head and neck doing? Are they able to shift the rib cage in that motion? Like how is that whole movement connected as opposed to just going, I need the hind limb to step forward and across.
Yeah. When I was doing my functional osteopathy diploma, they had that as well with the horses as a big part of the assessment. It was a constant reminder to look global, look local, and then always finish with global. Like, how does it fit into the whole space? Good reminder.
Yeah, and that's really what we're kind of talking about, isn't it? Like, we have to keep coming back to that whole horse picture to create the best outcome. So sorry.
If you go into a handful of muscles that possibly are either undermentioned or underappreciated, what would be ones that you'd tell people about?
Well, I'll pick 3 and then you can pick 3. So okay. I'm going to pick teres minor and major, like, because these are kind of deep muscles, but they're really important with shoulder function.
Mm-hmm.
And you can palpate them. And I've had a couple of horses. I had one horse that, I think he had an injury in this muscle, but it's not about the terry. It's about their function as a whole for that limb. And so they sit just behind, well, Terry's minor sits just behind the point of shoulders. And so, he's a muscle that's probably under recognized, like he's still important in shoulder flexion. The other one I'd go for, I'm going to stick with the front end right now, but subscapularis. So subscapularis is a muscle that's underneath the scapula. It is important in its attachment to the body. It's not part of the thoracic sling because it sits on the back of the scapula. But it is important again for shoulder stabilization and shoulder support because the shoulder doesn't have internal ligaments. So, and I know of a horse that was diagnosed with a subscapularis tear, but it took her like many, many vets. And I reckon I've had a couple that I was suspicious of because they lost scapular stability. So that one's important for scapular motion and scapular freedom on the body. And my third group is the head obliques. Because like we touched on the pole before, like we were talking about this off air, but and we're going to have another podcast talking about the effect of pullbacks and things. But we have a lot of horses these days who have to eat out of hay nets. It's the way that it is. And I see a lot of tension in the head obliques because of eating out of hay nets, which is fine. But then when we ask for that, little bit of lateral pole flexion, the horse can't give it to us. And if they can't give us that, we can't expect the whole body to be able to give us an optimal posture. Like the pole is really important for comfort, but we then have so many connections that go from the pole to the hind end and vice versa. And so if those head obliques aren't comfortable, then we're going to have resistance in even their ability to go forward and stop, just because of the head motion there. So what would be your three?
Well, seeing as you've gone front end, I'll go for the hind end.
I forced you to go behind end.
So I would say an interesting one I don't see mentioned very often is the gastrocnemius muscle. And it goes from basically on the femur, just above the stifle on the back, above the stifle on the femur bone. And then it runs down the back of the leg and it attaches onto the tip of the tarsal. So that is the point of the hock. And running between those points, it allows the hock to extend, so straighten out. And it has a little bit to do with flexing the stifle as well. And I think it's a very important muscle because I know you've seen this, and I thought that I'd seen an example of it very early on in my work where it was very fibrotic. And the horse wasn't flexing their hock or stifle. And so with some very, like a really long, it took me a couple of sessions and some really long periods of work, like soft work around that space. It got much less ropey and the horse started flexing their hock and stifle again. And the hock and stifle had been x-rayed for no bony changes. And it just seemed to make a huge difference. And I think just the muscle itself, and the horse had a fence injury where the leg got stuck. And there was a little bit of mottled skin changes over it. So it was just a muscle that obviously had some limitations and was very important in that horse. Another muscle I would choose would be the iliocostalis. So it runs along the sort of the shelf of the ribs, almost just above, but in the thoracic and the lumbar part of the horse. And it's part of the erector spines. It has a role in both bending the horse for flexion laterally and also to help extend the spine. And it can be sensitive sometimes when there's a horse who has poor saddle fit, or if they are trying to stabilize their spine, it seems to become very hard and ropey when you dig your fingers into it. A lot of horses can be sensitive there. So I think it's one that runs along a space where you would think there isn't a singular muscle there, because it just looks like the back kind of fills up, but it's made up of lots of different muscles. So the iliocostalis is really important. And my other one we've already done an episode on this, but the psoas group, I think, is such a valuable group of muscle that called the iliopsoas. There's the psoas major, psoas minor, and iliacus. And I think it's so interesting because they form a triangle in my mind, between sort of underneath the lumbar and ribs to underneath the wing of the pelvis and down to the inside of the femur. And they're valuable for flexing the lumbosacral joint and protracting the hind limb, and also externally rotating the hind limb. And so I see horses sometimes that look like they have a tucked under bum and their back legs are externally rotated. So the toes are pointing very far outwards off the body. And when you can help them through body work to relax those muscles and engage them in an appropriate way, it makes a big difference for the horse. So I think it's so important, that group, that we did a whole couple of podcast episodes on them. So definitely worth listening to. So they'd be my three.
Yeah, and I guess with the psoas and the iliocostalis, specifically, is that if the rest of the body is not functioning optimally, so like for the psoas, for example, like if the thoracic sling is not able to function optimally, the psoas comes under a lot more strain. And if the feet are uncomfortable, the psoas can come under more strain. Yeah. And if the jaw is sore for some reason, the psoas can come under more strain. It's like, yes, we get psoas injuries, but sometimes they're caused by imbalances in the entire body. And that when we're looking at them, we need to look at, okay, what's going on like in the rest of the body to then help that particular group work more efficiently. And the same with the iliocostalis, like you mentioned, saddle fit.
Yeah.
And it's like, so the iliocostalis is a insight into how the body is working. And so we can say, oh, well, we want to get that relaxed. It needs to be soft. But it's like, what else do we need to address in the whole body of the horse for that to be able to work efficiently and not be put under strain? Like, it still has a function,
yeah,
and it still has to work in its function, but it's a whole body issue when we see a strain in a muscle or a overworking, underworking. And I also just wanted to talk about the peroneus or fibularis tertius and the superficial digital flexor, because they're the reciprocal arrangement in the hind end. So what that means is the ability for the hock and the stifle to flex together and extend together, and that's creating efficiency in motion for the horse. But I've dissected a few horses where in the superficial digital flexor attachment, which is like in between those gastroc heads, where it's felt like fibrous scar tissue in there, and it's just not an area that we would investigate, like unless the horse is lame, but they can have little micro injuries. And like what you said, I've had some horses where I've assessed in the gastroc area or that hock and stifle flexion, and I'm like, oh, this is not okay. And on deeper palpation, have palpated issues in there. So again, it's just going, well, maybe they're overusing their brachiocephalicus or their rhomboid up on the top of their neck to pull a hind end along that's got a superficial digital flexor attachment issue. It's like not a common area that we would look, but that's why we have to put the pieces together of the individual horse, and think about where they are and aren't using body parts. And the other aspect of that, which you can kind of talk about too, is like, okay, we're talking about all of these muscles, but muscles can't work properly if the spine doesn't work properly.
Yeah.
Like we can't, it's the chicken and the egg there as well, right?
Always. And I mean, what you're saying about the erector spinae and function, because it has to do with spinal function and stability, when you see, when you understand that there are still certain groups of muscles that relate to different functions. So, you know, sorry, not the erector spinae, the iliocostalis, that muscle itself, if you're seeing symptoms in it, it's not just the muscle has an issue. You know, you have to look at the spine as well and be like, you know, what is and isn't moving, or what's moving too much to make up for areas that don't want to move. And then what is the underlying cause of that, and how are you going to address it? Is it a strength issue? Is it an old injury or functional issue? Core strength, saddle fit, how they're being ridden, old age. There's just so many factors.
And that's like, and also, you know, can the back actually flex? Because if the back can't actually flex, it can't develop like the other muscles to support it. And I think, you know, when I'm treating a horse, to me, it's always what I call a puzzle. You know, I'm always like, the horse's body is a puzzle, and ideally all the pieces would fit together and they'd all kind of be a similar size, or if they're different sizes, it all ends up to make a whole puzzle, and it, you know, creates a beautiful picture. But in some horses, the puzzle is really complicated, and I will be going, okay, like that's not working, this is working. Why is that? Like, I had a horse the other day, a young horse, and I've seen her before, so I knew she had a shoulder issue, like a scar. But I was like, okay, the shoulder's not working properly and the lumbar's not working properly. Now, old me, like years ago, would have been like, oh, I've got to get that lumbar working, you know, and so I would have been maybe focused on there because it was so obvious that that was really restricted. But the more you understand anatomy and connections, I'm like, nah, I think the lumbar's being pulled by the shoulder. And so she had a scar, like biceps brachii into pecs, ribs really restricted on that side, couldn't extend the forelimb, shoulder was kind of sitting up and into the body. And so like address the shoulder, which took a while. And then I'm like, okay, then we did a lot of movement stuff. So we actually did a lot of reprogramming of her movement and helping her to soften her neck and move her shoulder in an appropriate way and kind of get back that movement. Then I went back to her lumbar and I was like, oh, sweet, hardly anything to do here. Just have to get it functioning. So I had to show the lumbar, okay, you can flex, you can do this, you can do that. And again, we went back into motion, got the horse moving, showed her how to move, and then let her move. And, you know, that's kind of an example of working with the whole horse. Like, yes, there was a shoulder issue, but we had to integrate that movement through the entire body. You know, for her, like I won't see her again for maybe 6 months, you know, like she's not a horse that I see on a regular basis. So I have to optimize what I get out of a session. And then give the owner appropriate exercises to continue to make sure that it doesn't kind of jam back up again. So yeah, really important to integrate that within the entire body. And also I'm constantly trying not to make assumptions about what's happening in the body. It's like, okay, I've got this piece, this piece, this piece, that piece, they don't fit together. Okay, now this piece and this piece fit together. Okay, how can I get these other pieces to like fit in this horse? And every horse has a different puzzle picture that we're working with. And we really, need to consider that. I'm sure you've had experiences with that as well.
I have, and I do, even though it's a little bit crude, I love the saying, to assume is to make an ass out of you and me.
Yeah.
And I was having a conversation with a physio the other day, and we were just talking about how interesting it is, his work versus mine, working with horses versus people, and the idea that he said, oh, like, it's so interesting. I have a hard enough time getting compliance from people or understanding what's going on. How interesting to be working on the body of somebody you can't speak with. And it just reminded me, and I always think this when it comes to hoof care, everything is an interpretation of somebody else's body and they can't tell you. So you are drawing meaning from the state their body is in, from research that people have
Your
done on
experiences.
anatomy, movement, understanding horses' emotions, what feels good to them and what doesn't feel good to them. And we have never had a spoken conversation with a horse.
Well, I don't know about you, but
Yeah. Yeah, we have some pretty deep and meaningful in the paddock, with a coffee. I do honestly believe that there are ways to have incredible lines of communication with horses.
Yeah.
But it's just
It's
very
a different form of listening.
it's a true interpretation of somebody else's body, and to be trying to change them from your own perspective, as well informed as that may be, to draw conclusions between things. And it's just so easy to miss something. I mean, coming back to a horse after you've worked with them and you think, I hope I missed that last time because you weren't showing me, but you could have, and I can't inspect every muscle, deep or superficial, and there's just so many things to consider and are going on. And just the fact that there's it's so whole. It's almost impossible to encompass how whole it is.
Yeah. And I think in that wholeness, we've talked about, okay, muscles and the importance of looking at them as a whole. And then we've talked about the spine and the importance of looking at that as a whole and then joining those two together. But then we also have the emotional state of the horse, which can dictate muscle use and spinal function as well. So some horses, it's the emotional, and I'm going through this with Ellie at the moment, like dealing with her very strong opinions and emotions. And yes, she has body physical imbalances, but I can deal with them all day if I don't get her emotions on the same page to then help me deal with her body. So, horses with muscle imbalances can be emotional, but horses that are emotional for whatever reason, trauma or just it's them, whatever, we also can't work with their body in a way that's going to help bring balance into their musculoskeletal system. So, we can talk about one muscle, but like you've just highlighted all of the other aspects that can influence that and the emotional aspect of it. So the more we can create a holistic view of the horse, the more we can help them in their postural journey, and we can, create a horse that has much better balance for itself and its ability to carry us. And yeah, we can also help them to develop much better efficiency in the way that they use their body in every circumstance as well.
Definitely, to have an adaptive movement system that's efficient and is as good as you can be in your own body, aiming for better, not perfect.
Yeah, definitely. So, I think in terms of addressing this, we have a lot of podcast episodes that kind of talk about the specifics of looking at the body as a whole. Like you can go back to episode 2, I think, where we talk about observing the horse's posture and then utilizing variable feeding positions to help their posture. And then we've talked about some specific things like roach back and psoas, and then we've talked about things like mobilizations and activations and lengthenings and how that can all help. So, there's definitely a lot of episodes that you can have a listen to that help you appreciate the horse as a whole. And yeah, do you have any kind of takeaways that you'd like to impart with?
I think we covered most of it, all the things that we wanted to get across. just that, you know, it's respectful once you can, it's achievable to ask a horse to carry you in balance only once it feels balanced in themselves. Like that is self-balance.
And recognizing what that balance looks like for your horse.
Yeah. And and just how unique it is. You know, one horse, you know, if you are getting hung up on individual muscles, sometimes your horse might need to have that muscle be a bit more developed or a bit less than another, or a bit stronger somewhere else. And that's okay. And you're just working for better in the best informed way that you can be with your professionals, your team. We even have an episode on that, to do the right thing by them.
Yeah. And just recognizing that all the muscles matter, that the balance is dynamic, and that we can, you know, support them therapeutically and through training to have a more holistic approach to their own body and the connection to each individual muscle. But we're looking at it from a whole perspective. We don't have to, get caught up in the individual ones if we just look at the whole body as a whole. Awesome. Well, thank you for joining myself, Dr. Raquel Butler and Sophie Vandenberg in today's podcast. Enjoy your horse time. Please subscribe to the Equine Functional Posture Podcast so you don't miss our weekly episodes, and give us a 5-star rating so we can share more valuable insights. Keep an eye out for our next Equine Functional Posture course, because that's where we can really develop this holistic approach.
Wonderful. And we will see you in the next exciting episode.